Hey guys, good evening. How are you doing? All right, guys. So this evening we are going to look at our NPTE exam. All right. And our topic this evening is how to think like the NPTE clin exam, clinical reasoning. All right. So um basically our lesson overview is going to be what is clinical reasoning? How does the NPTE thinks? We're going to be looking at question traps, decision making strategies, and practical applications. All right. But before I go into all of those, I want to ask you two questions. First question: what is more important, knowledge or decision making? And my second question, as you know, you can respond to the questions on the platform. Have you ever chosen the wrong answer, even knowing the content and why? I want you to write and tell me and give me some reasons why. Have you ever chosen the wrong answer, even knowing the content and why? All right. Now, first of all, I want to go into our first vocabulary, technical vocabulary, and we're going to be looking at terms and meaning. Clinical reasoning. Clinical reasoning are decision-making processes in patient care. Prioritization is basically choosing what is most important. Assessment is evaluating the patient. Intervention is basically the treatment decision that you made, and the outcome, the results of the treatment, right? The second part of our vocabulary, red flags. What are red flags? Red flags are basically signs of serious conditions, all right? Conditions such as contraindications, which is basically a reason not to treat the patient. So we're looking at safety. Safety is basically the protection of the patient, right? And the patient's progression is the advancement of the treatment that you're doing. Also, we're going to be looking at best option. Best option is the most appropriate action you can take. Now, remember I said at the beginning, we're going to be looking at thinking like the NPTE. Now, the NPTE it's not a memory test. It is clinical reasoning. It's a clinical reasoning exam. Each question is designed to evaluate how the candidate thinks in real life, real time situations, right? So instead of asking, what is this? The exam asks, what should you do next? So there are scenarios. You're given multiple choice answers, and they ask, what should you do next? All right. You must analyze the patient's condition, identify the risks, prioritize your actions, and select the most or the safest action or the most effective intervention for the patient. Patient safety is the priority. All right. Now, in many cases, more than one answers may be or may seem correct. All right. but the best answer is the one that demonstrates safety. It's not the prettiest answer. Think logics. It's not the prettiest answer. It's the best answer. All right. And the best answer demonstrates safety, logic, and clinical priority. All right. All right. So based on that, here are your questions. Does the NPTE focuses on memorization? Your answers up there. And what type of thinking does the exam require? 3, what makes an answer the best option? All right. So any questions you have, you write them up there. All right. We'll answer them. Clinical language. Well, clinical decision language. There's some phrases that we use that helps us understand, right? Or are so, it's not understand, but they're so organic, right? That they sound natural. And these are a few of them. The therapist should prioritize safety. The patient may present complications. This intervention must be avoided. In a clinical use, it's a tumor decision justify escollas. All right. Make informed decisions. Okay. That's your priority. Make informed decisions. And how do you make informed decisions? All right. Based on each case, you make informed decisions with the safety of the patient as priority. Good. Now, the NPTE test is done in order. All right. First, you identify the problem. Second, you analyze the situation. Third, you eliminate. Guys, this is very, 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 very important. The elimination of unsafe options. Always eliminate the options that put the patient at risk. So you take those out in your answers. Remove those first. All right. Eliminate unsafe options, and you choose the best answer, not just the correct answer. You choose the best answer based on your reasoning. Okay? Great. Now, in every test or every exam, there are what we call common traps. Or layman's term, they try to trick you. All right? They try to trick you with similar answers. But here's what you do. Answers that are correct, but not priority. They're correct, but think priority. Options that ignore patient safety. We eliminated those already, so that's not even relevant. Treatment given too early. Have you assessed? So you need to assess before you start treating. And if there are red flags, right? If there are red flags, meaning if there are unsafe options, don't even think about it. All right. So the rule is, the golden rule is safety, logic, and technique. All right. That's basically what it is. Good. Strategy. When answering read the last sentence first. When you're answering questions, read the last sentence first. Identify what the question wants, look for red flags, eliminate wrong answers, and then choose the safest. I will mark this all the time. I emphasize this. The safest option is the best option. All right. As I said before in the previous, from the previous page, right? Options, answers that are correct, but not priority. Those are dangerous. Okay. So what we want to do, sorry. All right. So what we want to do, we want to choose the safest option. All right. Great. Good. Now let's move along. Controlled practice. Choose the best answer. A patient presents with acute pain and swelling after injury. What should the therapist do first? A, start strengthening exercises. B, apply aggressive mobilization. C, assess the condition. Or B, begin functional training. Put your answers up there. Next, for your practice, why is safety more important than speed in clinical decisions? 2, what does best answer mean in the NPTE? Your answers up top. Okay. Now, before we go to our final segment, which is the role play, I want you to read your little fact. In many NPTE questions, 2 answers are always correct, but only one is the best based on, guys, I cannot stress this enough. I'll read this again. In many, I would go as far as to say in most NPTE questions, 2 answers are correct, but one is the best based on priority and safety. Your number one priority is the safety of your patient. Okay? That is your number one priority. Okay? All right. Any questions so far? Great. Now we move into our final section, which is our role play, a student preparing for NPTE. Sorry. Hey, no, obviously I'll be playing the both parts, right? So, Clayton, I've studied everything, but I still get questions wrong. Why? Well, that's because the NPTE is about reasoning. It's about reasoning, isn't all right? Reasoning. So it's not about memorization. No, you need to think clinically. Think clinically, all right? Think clinically. But how do I do that? Well, focus on safety and priorities. Your number one priority is the patient safety. So not all correct answers are right. See, you need to choose the best answer. That makes absolute sense. That makes sense. All right. Practice thinking like the exam. Okay? All right? Think like how the exam thinks. Okay? All right. Any questions, guys? All right. So that leaves me just to tell you, thank you so much for your attention. Thank you so much for your time. Want to thank you for being here with us, for watching this class. Have yourselves a wonderful day, and we'll see you in the next one. Okay? Bye bye.